My name is Risheng Xu, and I am a cerebrovascular and endovascular neurosurgeon at Johns Hopkins. This year at CNS, we had a wonderful lunch seminar on the management of chronic subdural hematomas. Chronic subdural hematomas are a very common affliction of the elderly population. As we get older, it's easy to fall, and a good number of patients are on blood thinners. And after even very small traumas, you can develop a very small bleed in the brain that doesn't cause any problems at first. However, over time, that very small bleed can expand. And over the course of days to even months, that very small bleed can really grow to a substantial degree of blood around the brain. And that can cause significant symptoms in patients. And patients oftentimes come to the emergency room or come to neurosurgical presentation with symptoms such as headaches, difficulties concentrating, lethargy, confusion, even weakness. And the management of these patients has really changed really over the course of these last few years with the advent of middle meningeal artery embolization. The lunch seminar really talked about the pros and cons for all sorts of management strategies, starting from conservative management, which is really doing nothing but repeating scans and close observation for the patient. Of course, it also discussed the role of middle meningeal artery embolization, which is a minimally invasive procedure whereby we put a small catheter in the patient's arteries and we go up into the middle meningeal artery and we glue those arteries shut. And in three major clinical trials this year, in a randomized fashion, middle meningeal artery embolization was shown to significantly reduce the chances of subdural expansion. We also spoke about the surgical management of subdural hematomas, and that can range anywhere from burr hole evacuation all the way up to a small craniotomy, and of course, a hemicraniectomy. But a large part of the conversation really centered around how middle meningeal artery embolization could serve not only, in fact, as a standalone procedure for chronic subdural hematomas, but also serve as an adjunct procedure after surgical management, such as burr holes, to further decrease the chances of subdural hematoma reaccumulation. The area is very, very exciting. There's a lot of new trials and new research in this area. We spoke about outstanding questions and future directions, including the role for new materials for embolizing the middle meningeal artery, as well as how this procedure can be used to treat patients with headache for patients with chronic subdural hematomas.